We're much better prepared than we were 5 years ago because the government has invested huge amounts of time, energy, brain power, and resources into getting the federal government, state and local governments, and the private sector better prepared. The real challenge is at the beginning of a crisis like this, we're seeing the best. We're seeing things well coordinated, good messages, people beginning to ramp up their response. The big unknown is if this becomes a much larger crisis, whether we still have the capacity to respond as effectively as we would like.
What we need to do is to recognize that there needs to be a constant and sustainable source of federal funding for local health departments nationwide. We respond now on an episodic basis, and then when local health departments do their job well, we take the funding away. And then we have another crisis and we recognize that we need to fund them again. In fact, local health departments are busy with this kind of work on a day-to-day basis, and they're barely staffed up for the work that they need to do on a daily basis.
With a novel virus like this H1N1 virus, it's completely new. None of us have any underlying immunity. We haven't been exposed to different parts of it before. And we have to start from scratch in developing a vaccine, and that could take 6 months.
We're vulnerable in not having the capacity, for sure, in our local and state health departments to deal on a continuing basis with a novel and serious threat.
The treatments that we have, the antivirals that we have, require treatment within 48 hours. If I'm uninsured and I can't afford a doctor's office visit, the first day or two I'm not feeling so well, I'm going to see if I can ride this out. Maybe I'll feel better on my own. You then miss an opportunity to contain the spread of the virus and to treat that person. So not having insurance or having inadequate insurance can really make a difference from a public health standpoint.
There's the potential to think that because we know there were a lot of cases in Mexico, to say that Mexicans are some way unhealthy or people of Hispanic origin are somehow less, are worse or less good than the rest of us. The fact is that disease doesn't recognize any border. It doesn't recognize any particular person or nationality. It happens. An infectious disease will always happen.
If we get through the next few weeks and things die down, we should all breathe a sigh of relief, but we should not let down our guard, and it will be even more important in the fall if this virus reemerges as part of the flu season to be particularly vigilant.